those of you who don't know me, I'm Amy Finan. I'm the CEO of the Sabin Vaccine Institute. And of course, I'm really delighted to welcome you to this year's Albert B. Sabin Gold Medal and Rising Star ceremony. I really want to thank you for taking the time to join us and celebrate what we consider our global immunization heroes for this year. I'm also grateful to the Academy for allowing us to use this beautiful and historic building where they've celebrated so many scientific legends. And we're going to add a few to that today. And importantly, I'd just like to thank our sponsors for helping us with this event, the Bill and Melinda Gates Foundation, Pfizer, and the Serum Institute of India. I see a lot of friends and supporters of Sabin in this room. This is my 8th year with Sabin. In fact, I joined 8 years ago today, and my colleagues had me come and host this event on my first day of work. That was quite a shocker, and I know a couple of you in here were at that particular gold medal ceremony. But Sabin certainly has changed and evolved so much in the last 8 years. And I really want to thank everyone, especially our former gold medal recipients who are here with us this evening, for their continued support of Sabin and the gold medal throughout the years. So if I could have the few former winners that are here, if you could stand for acknowledgement, I'd really appreciate it. Mike, you may be representing the whole team. Oh, there we go, Roger. Thank you. I just want to give a special few shout outs to a few people in the room tonight, in addition to Mike and Roger. But I really want to thank and acknowledge Kathy Newsel, who's with us tonight. She's a long-time Sabin collaborator and Sabin supporter. And we really want to extend our congratulations to Kathy on behalf of the entire Sabin team for her new position as the new director of the Fogarty International Center and the NIH Associate Director for International Research. And Kathy will also be the first woman to serve as the permanent director of Fogarty since its founding in 1968. So, you go, And I also just want to extend my thanks to Kathy for stepping in to introduce our 2024 gold medal recipients. Kathy Edwards from Vanderbilt was supposed to join us tonight, and unfortunately a personal matter came up and she was unable to make it. I'd also like to give a special shout out to our 2021 Rising Star, who's here with us this evening. And Gina, are you here? Where are you? There you are. You can stand up, right? Thank you so much. From Malawi, and as luck would have it, she is actually studying this year for her PhD at the University of Maryland at Baltimore, and as luck would even further have it, she's actually working with Kathy's team, and Kathy Newsel's team at the center, and she really does consider Kathy a mentor. So we're so thrilled that you could be with us tonight. We were talking earlier, you were awarded this Rising Star during the pandemic, and so we've actually never met in person. So welcome to the Academy, and we're thrilled that you could join us tonight. So, I think, as most of you know, the gold medal is the highest scientific honor given by the Sabin Vaccine Institute and recognizes vaccinologists for their extraordinary contributions and impact on global health. Since the award was first given some 31 years ago, every gold medal recipient has really embodied Dr. Sabin's belief, and I believe it was a belief because it was really ingrained in him, that immunization is as much about equity and health justice as it is about science. A humanitarian first, Dr. Sabin traveled the world championing polio immunization and eradication, and challenging, and I understand very much challenging, world leaders and scientists alike to confront not only the disease, but also poverty and despair. Like Dr. Sabin, our organization works with partners around the world and across the immunization spectrum, from vaccine development to delivery, from aiding research and disease surveillance to boosting the capacity of immunization professionals for more effective vaccine introductions and greater uptake. Sabin's model for improving and protecting the health of people living in low-income countries is about investing and working with people in countries who are local partners. We are not about creating Sabin outposts in those countries and bringing in our own team to do the work. Rather, we are eager to build partnerships with local communities to actually bring more impact and solutions driven by the community to the community. We firmly believe that when communities and local partners are involved, that the impact of all of our work will be much greater, and the uptake of any work that we do will also be much greater. So now, on to the main event, the awards. So tonight, we welcome two remarkable global health champions to receive the Sabin Gold Medal for their outstanding work in the development of vaccines against pneumonia and diarrhea disease. Their teamwork, Keith and Shabir, you made it, more on that later, has been nothing short of heroic, as these diseases are major causes of death in children in low-income countries. Their work on this front has helped avert more than 3.5 million deaths, so that's quite an impact, and congratulations to both of you. Keith and Shabir's research has also helped pave the way for introduction of life-saving vaccines and public immunization programs, including the pneumococcal conjugate vaccine, where their findings were pivotal and influenced countries' vaccination policy in low resource settings. To speak more about tonight's awardees, we have, as noted earlier, Dr. Kathy Newsel. Kathy has known both Keith and Shabir for many years. She collaborated closely with Keith on maternal immunization and pneumonia initiatives at the Gates Foundation, and has worked with Shabir on a large rotavirus vaccine trial, very large, and is a fellow member of the WHO's SAGE group on immunization. But before Kathy's remarks, we're going to watch a short video that tries to capture all of your good work.
My first professional close relationship with Keith and with Shabir was when they were in South Africa at WITS. We had developed a pneumococcal conjugate vaccine. We really wanted to see how this vaccine would work in a population like in South Africa. And the study that was done by them, one of the largest studies done with this vaccine, was enormously successful.
So I really entered into the field, really not knowing what it entailed to be a clinician scientist and what it entailed to be a researcher.
He and I were, along with many others of that generation, were at the front lines of fighting apartheid. Our roots as activists, I think, is what fuels us as professionals today.
I was born in South Africa at a time when there was enormous inequity in South Africa, and I think that influenced my future career.
Our parents were also, both of them, very ethical people who modeled to us the practice of service to others. And you can see this in the choices Keith has made throughout his career to try to do work that would make a difference to people across the world.
I was the director of the South African Institute for Medical Research, which I needed to recruit someone to head up the clinical aspects of the trial. And I was delighted to be able to appoint Shabir Madhi to that position.
And it's really under Keith's mentoring that I really got to understand some of the nuances of what it meant to be a researcher. And what happened subsequently is really one of me realizing that as a healthcare practitioner, there was much more than just being a practitioner and providing care. There were other opportunities which medicine actually presented, where you are able to basically contribute in a way which goes beyond just being able to deal with an individual at an individual level.
He and Keith really did the seminal trial on pneumococcal vaccination, showing that it was highly effective in our setting in South Africa, and that it had added benefits beyond just protection of pneumococcal disease. With Keith's support and mentorship, the two together really have done some of the most outstanding work globally.
It is extraordinarily gratifying to have someone of the caliber of Shabir to not only run a successful research unit, but he expanded it greatly and has done incredible work over the past decade to evaluate a number of vaccines that can save lives of young children globally. Before we did our work on pneumococcal conjugate vaccine, close to 1 million children were thought to die every year of pneumococcal disease. The introduction of these vaccines has saved millions of lives over the past 1.5 decades.
There needs to be a greater recognition that what vaccines are all about is not just about making profit. What vaccines are about, and have always been about, is about saving lives and reducing suffering. We need to re-engage as a scientific community, and we need to come together and realize that we are one in this small planet that we inhabit. And it is in all of our interests for there to be greater equity when deploying vaccines.
I believe strongly that the secret to a successful career is to be passionate about what you do. So I have given hundreds of lectures around the world, and I hope that my enthusiasm for saving lives, my enthusiasm for these extraordinary vaccines can be transmitted to the audience. And it's that enthusiasm that means I do this with joy.
For people working in our field, I think the Sabin Gold Medal is the top award one can receive. It's an amazing feeling to get up there, in front of your colleagues, and to be honored.
So good evening, everyone. It's always wonderful to be here and see so many friends and colleagues, and thank you, Amy, for the kind introduction. Keith and Shabir, the first part of this, I will be reading what Kathy Edwards sent me. So when I say I, it means Kathy Edwards. I'm going to read verbatim what she wanted you to hear. It is unfortunate that I am not able to be with you tonight, but wanted to share my previously prepared introduction and thank Dr. Newsel for agreeing to present it. I first became familiar with Keith's work in the late 1980s when he began to report the extraordinarily high rates of penicillin-resistant pneumococcal disease in South Africa. Coupled with the burden of HIV, the impact of invasive pneumococcal infections was enormous. Over the next decade, Keith became a global leader in characterizing the extent of invasive bacterial disease in adults and children, serving on numerous international advisory committees, and spearheading academic initiatives to address this problem. Then in 2014, enrolling nearly 40,000 infants in Soweto, Keith, Shabir, and colleagues clearly demonstrated the impact of pneumococcal conjugate vaccines on reducing the burden of pneumococcal disease and ushered in an era of pneumococcal prevention through vaccination. The conduct of this trial was extraordinary and has served as a model for the numerous seminal trials that have been conducted in the region since. Associated with this trial was another seminal paper authored by Shabir and Keith that clearly demonstrated the pivotal role of the pneumococcus in viral pneumonia. As I reviewed and accepted this paper for Nature Medicine, I was so impressed that this important scientific discovery had been made. At about this time, Keith moved to Emory University, and Shabir assumed leadership of the research unit in Soweto. Keith was so proud of this selection, and his choice has proven to be an excellent one over the past many years. During this period, my group at Vanderbilt came to work with Keith to longitudinally characterize bacterial and viral interactions in young Andean children. This collaboration was highly productive, with many publications and the establishment of a funded research unit in Peru. Keith was a wonderful collaborator, always the first to thoughtfully review manuscripts and immediately return calls. If you text Keith, you must be ready for an immediate response. No time to stop at the restroom. Moving from Emory to Gates, Keith has spearheaded multiple trials of maternal immunization, RSV and GBS vaccines, pneumonia trials, and studies to understand and reduce the impact of neonatal infections. He remains a friend with everyone he meets and has contributed greatly to the reduction in global mortality and morbidity. His impact has been enormous. I first met Shabir when he asked me to be on a data safety committee for a study of chlorhexidine to reduce neonatal HIV and GBS. As the DMC reviewed the study, the methods were meticulous, early career researchers were empowered to serve in leadership roles in the trials, and the culture of excellence was apparent. Through the years, I have returned to Soweto to participate in several advisory committees, program evaluations, and international conferences. I have been asked on numerous occasions by the South African Research Council to evaluate Shabir's work. Perhaps I am not supposed to reveal my evaluations, but every time I reviewed Shabir's program, I gave it the highest ratings possible. A highly skilled investigator, Shabir is unparalleled. I also want to say a few words about the program that he started with Claire Cutland in South Africa, modeled after ADVAC in Annecy. This program brings African investigators interested in vaccines to South Africa for 2 weeks to hear lectures from global leaders and to network with other Africans to advance vaccine research in the years ahead. This program, under the umbrella of the African Leadership in Vaccinology Expertise Consortium, or ALIVE, will be a powerful way to help reduce the global inequities associated with vaccines and train the African vaccinologists of tomorrow. Finally, with the pandemic, Shabir and his team were leaders in the clinical development and testing of COVID vaccines. He was awarded a national citation for this work, which was very well deserved. In summary, I am honored to know Keith and Shabir and to call them colleagues and friends. The commitment and excellence have made an enormous difference in the health and well-being of the global community. With much love, Kathy. Now, I am going to take the opportunity to add just a few personal reflections on Keith and Shabir, both of whom I know well. And if you know Keith, then you have shared meals with him, which has involved some very good wine. We all know this about Keith. Shabir and I have also shared some exotic dishes, including a Wimpy's hamburger on my first trip to his unit in South Africa, which he claims to not remember. And also we shared with Falake, wherever she is, some mushroom ice cream, which I think we all want to forget. But seriously, Keith and Shabir share many traits that have contributed to their enormous success. I think the fact that they're sharing this award attests to their spirit of partnership and collaboration, parking individual egos at the door for the good of all. I have experienced this personally when working with both of them. As Kathy Edwards mentioned, their talents and contributions to science and public health go far beyond their groundbreaking pneumonia research. In my view, both are vaccine renaissance men. I am never surprised anymore to find Shabir or Keith's names among the pivotal publications on any vaccine. For example, when I was working with TIVAC, the Typhoid Vaccine Acceleration Consortium, to plan a large efficacy study of typhoid conjugate vaccines in Malawi, the first on the African continent, In my background research, I learned that Keith Klugman was well published in the field, including leading the first typhoid polysaccharide vaccine efficacy trial in Africa, a good 40 years before we were going to do this. And as we did 4 decades later, he used a meningococcal vaccine as the control. I first worked with Shabir in the mid-2000s, and I'm not sure if he remembers my phone call to him asking him to be involved in the rotavirus vaccine trials in low and middle income countries. Shabir ended up being the first author on the New England Journal manuscript for that study, reporting the efficacy of the monovalent rotavirus vaccine, directly informing WHO policy and country introduction. And of course, his team has continued to study rotavirus and are now leaders in the field. Now, Keith and Shabir are not only internationally recognized scientists, but they are generous champions and tireless champions for vaccines around the globe. I've served on committees with both of them, and neither of them misses an opportunity to advocate for the world's most vulnerable populations. Shabir and Keith, your achievements are nothing short of phenomenal. You richly deserve this honor, and my sincere congratulations. Thank you.
The gold medal is in here. So on behalf of the Sabin Vaccine Institute, please accept this award. We are thrilled and delighted. You're a great person to receive it, and we so respect all of your commitment to everything. Science is one thing. You're a great scientist, no two ways about it. But your commitment to really serve people living in low-income countries is just outstanding. Thank you.
Well, usually I just talk off the cuff, but seeing as this is a sort of special occasion, I made some notes. So thank you, Kathy, and both Kathys, for your wonderful words, and thanks so much to Sabin for this extraordinary award. It is truly a privilege, and I'm sure that Shabir will repeat, when you look down the list of people who've had it before, it's an extraordinary privilege to be listed among them. So I was asked to make a few remarks, and I thought, well, where do I start? And, in the interest of not boring you entirely, I thought, well, I'll start with my conception in 1955 and birth in 56. But my sister did it for me. I have to pay tribute to her. I was once at WHO with my sister Barbara, who's an activist for civil rights and particularly for women's rights. And it was actually extraordinary because when I'm with her peers, I'm Barbara's brother. And so she, I think in many ways, has really been an extraordinary influence in my life. There are a number of people who have been an extraordinary influence, many of whom are women, and of course another was my mother, who brought us up in apartheid South Africa with a very strong sense, a grievance against what was happening, and a very great sense of fairness, which she imparted to both of us. And so then my dad was a brilliant man. One anecdote I'll tell about him was that when he finished high school, he won a gold medal for physics. And when he started medicine, in his class was a person called Aaron Klug. And they sat next to each other because Klug and Klugman next to each other. And Aaron Klug decided he didn't want to spend his life seeing patients, and he went off to win a Nobel Prize for physics and chemistry. He actually won it in chemistry, but he was also a physics person. And my dad told me, well, I did better than Aaron in first-year medicine physics. But Dad spent his life as a devoted physician and got me into the medical business. But right from the beginning, I I wanted to become involved in something bigger in global health. And so life is really very much about mentors, and I was really fortunate to go into a department at the medical school in Johannesburg, where the microbiology was run by this extraordinary man. He's still alive today. He's well into his 90s. His name's Hendrik Koenhoff. And as Kathy Edwards alluded to, there was this outbreak of resistant strains, pneumococcal strains resistant to antibiotics in South Africa. And he had books and books of all the cases of these strains. And so when I came into the department, I said, well, this is a gold mine. And in a very early stages, I put it all together in a relational database and started to publish what we had found. And the epidemiology of pneumococcus led me naturally, I guess, through a stint at Rockefeller University with Emil Gottschalk, and then eventually to set up the research unit in South Africa. And there, of course, one of the better decisions I made was to recruit Shabir, and more of that in a minute. But life throws strange curves your way, and I lost my first wife very young. She died of lung cancer. And at the same time, given some of the political issues in South Africa, running a national entity, I decided that I could do more coming to the States. And I'll pay brief thanks to Roger Glass, who's here in the audience, who had the foresight to suggest to me that rather than going to Boston, where my natural inclination would have taken me, he said, well, what about Atlanta, Emory and CDC, and had a wonderful time there for many, many years, and was able to collaborate, work back and forth with South Africa. There are a bunch of mentors that I could mention. I'm just going to name one or two of them. From the time that I was in the States, one of the remarkable things that had changed for a South African was that now you could really do work on the global stage, because Mandela had come to take over the country in 94. We're talking now the early 2000s. And I met remarkable people, and one I wanted to speak about particularly is Helena Mäkelä, who was from Finland and really a giant in the field of Haemophilus conjugate vaccine rollout. And she and I together figured that the world was changing, and there were great opportunities through molecular approaches, so that in the past, if you were in a remote part of the world, there was no way to characterize strains unless you had specific antibodies reagents, which often were only available at a few places in Europe or America. And suddenly sequencing was a great leveler, and so I was delighted to set up a program where we sequenced 25,000 pneumococcal genomes. And then through that and other things, I ended up at the Gates Foundation. And I must say that this has been an extraordinary privilege. So what I want to say at the end is that there are two more people. Well, before I get to the last two, I also want to pay tribute to my wife, to Madhi, who's not only stood by me with this passion I have for my work, which I think Shabir will allude to as well. It does tend to mean that work comes first, and families often suffer. And Madhi has been amazing, and also, of course, brought 4 kids into my life who have been extraordinary. So to end then, the last few years at the Gates Foundation, it's been my wonderful privilege to have enormous resources made available to me by a couple who have really devoted their lives to changing the world and to equity, and trying to make the world a better place and helping the poorest of poor children. And vaccines are at the heart of their strategy. And so I do want to pay particular tribute at the end to Bill and Melinda, who have allowed me the freedom to help change the world. So thank you all, and I do appreciate this.
Okay, Shabir. So some of you may not know that Shabir has literally gone through floods and all sorts of weather to get here, being stuck in the Dubai airport, I do believe, for almost 48 hours. He arrived in Washington today at 5:25, I think your flight landed. And so we were all waiting for him to arrive, and we are so thrilled that you're here. And all I can say is your determination to get here definitely reflects the determination you have with your work and really putting your heart into everything that you do and helping people. So thank you very much.
Thank you, Amy, and good evening, everyone. So before I start, I have to make a call out to Brian and Reen. Brian's standing there. They've been absolutely amazing getting me to this place. So usually it takes between 14 and 20 hours to get from Johannesburg to Washington, D.C. It's taken me 60 hours. I was about to call it quits, but they did some miraculous work. So Brian, thank you very much. Highly appreciate it. So unlike Keith, who prepared notes but didn't bother reading it, I did prepare notes, and I am going to read it. Once again, welcome to everyone, and it's really a privilege for me to be here. And thank you to Sabin Institute for actually hosting us. So it's really with immense gratitude and humility to accept this prestigious Sabin Gold Medal, alongside with Keith, my mentor, my PhD supervisor, as well as a friend. Indeed, were it not for his blind faith in me, fresh out of completing my residency in pediatrics with nominal exposure to research, he decided to take the leap of faith and offer me this position of heading the largest clinical trial at that stage to be undertaken in the African continent, where we were planning on enrolling 40,000 children. And he asked me to take the clinical lead on this. Were it not for that, certainly my career would have been moved in a very different direction. At a time when I completed my studies in pediatrics, as Keith mentioned, it was towards the time when Nelson Mandela was released. As a person of color, research as a career pathway in South Africa, there were absolutely no models, and it's not something that actually crossed the mind. So it's really fortuitous that I ended up in this position. So I really consider myself an accidental vaccinologist, and one whom fortune has favored to be able to contribute in some small way to reducing suffering and death from vaccine-preventable diseases, especially on the African continent. My own contribution to the field of vaccinology pales compared to the past recipients of this award. In fact, I feel there's an imposter syndrome around. Mike Levine, Barney Graham, George Sieber, Roger Glass really makes me feel that I'm out of my depth standing in front of you. So it's a true honor for me to be here. I've had the privilege of getting to know many of the past recipients over the past 28 years and really consider them as role models. I've had the privilege of being able to sit with them in different scientific forums, including Kathleen Newsall. And really, for someone that comes from a country where there was almost zero expertise in the field of vaccinology, it's really having been able to engage with the likes of Kathleen Newsall, Mike Levine, Roger Glass, who convinced me that diarrheal disease was important, that I've been able to grow as a scientist. For those of you that don't know, unlike most others in this room, I haven't moved beyond a 50-kilometer radius since I was born. I grew up in one place in Gauteng, that's a province in South Africa, and really did all of my training at the University of Witwatersrand. And like I mentioned, at the time when I got involved in the space, there wasn't African leadership in vaccinology expertise, which is aiming to grow the cohort of scientists in vaccinology. And it was really sort of a lone journey. But again, something that I was able to succeed in because of the mentorship that Keith provided, as well as because of the engagement I was able to, that I was afforded with many other scientists, including past recipients of this award. So as someone grounded on the African continent, where the introduction of many life-saving vaccines into public immunization programs still continues to lag behind by as much as 10 to 20 years compared with its introduction in our countries, the receipt of this award from the Sabin Vaccine Institute is all the more special to me. As Amy pointed out, the essence of Albert Sabin was really significant in that he consciously decided not to pursue patent rights on the polio vaccine, a decision that had far-reaching implications for vaccine access and affordability, particularly in low and middle-income countries. Although my own research, which is supported by a remarkable team at the WITS Vaccines and Infectious Disease Analytics Research Unit, has been more on the translational science aspect of vaccinology, it is truly gratifying to be acknowledged for the research at WITS Vida that has contributed to the advocacy and decision-making for the introduction of these life-saving vaccines into public immunization programs, especially in low middle-income countries. So as we stand on the cusp of a new era in vaccinology, with challenges posed by emerging infectious diseases, the importance of the development and deployment of new vaccines has never been greater. Considering the inequity in access to vaccines which transpired even during the course of the COVID-19 pandemic, it's important to look towards the future. While translational research plays a crucial role in advocating for the introduction of life-saving vaccines into the market and public immunization program, the need to move beyond translational research on the African continent and actively engage in vaccine discovery is a challenge which needs to be adopted by African scientists. By building expertise and investing in vaccine discovery, the imbalance in vaccine equity can be redressed, ensuring timeless access to vaccines regardless of socioeconomic status. I do hope that by me receiving this vaccine would provide some sort of motivation to other African scientists to make that leap into vaccine discovery and development, which is necessary to ensure the future security of Africans against vaccine-preventable diseases. So before I conclude, I must once again reiterate the invaluable contribution of my team at WITS Vida, whose dedication and tireless efforts have been instrumental in the research and developmental endeavors that is being acknowledged here today. I would also like to pay tribute to the community where my research is undertaken, who graciously volunteered to participate in clinical studies. Their willingness to partner with us in the pursuit of scientific knowledge and advancement of public health is a testament to the spirit of what is referred to as Ubuntu in South Africa, which means I am because we are, or humanity towards others, emphasizing the interconnectedness between people, something which unfortunately is sorely lacking in many parts of the world today. Without the selfless participation and support of the community, my own research efforts would not be possible. And for that, I'm eternally grateful. Last but not least, in addition to my appreciation to my colleagues and friends who have graced this occasion by their presence, many of whom have also flown in, including my cousin Shinaz, who was flown in from San Francisco. I think she arrived about 15 minutes before I did. It is incumbent for me to recognize the sacrifices of my family in my journey towards the award. Unfortunately, but perhaps fortunately, my wife was unable to accompany me to celebrate this precious moment. She wouldn't have forgiven me with the 60-hour flight. And as Keith mentioned, there's always a cost to being successful, and I'm sure many other scientists in this room also appreciate the cost that comes with needing to put that extra effort to make things work. So as an anecdote, my son, who was 20 years old now, turning 21, when he was 10 years old, his teacher asked him in class one day, "Who do you live with, your mother or father?" And the reason his teacher probably asked him is because there's only one signature usually on a homework sheet. So he answered, "I live with my mother, but my father also stays there sometimes." So I had to sit him down and explain to him that I actually am part of the same family. Nevertheless, like I said, it would be amiss of me not to appreciate the understanding and at times grudging acceptance on the part of my wife and 2 children of the unhealthy imbalance of my work and family life, without which the receipt of this award
would probably not have been possible. In conclusion, I would like to once again express my heartfelt gratitude to the Sabin Vaccine Institute for this esteemed honor, and one which I will forever cherish. Thank you.
Thank you, Keith. Thank you, Shabir. So I'd like to move on to our next award, which is our Rising Star Award that honors emerging vaccine leaders with demonstrated commitment to the field of immunization. This year's winner, Professor Nicole Basta, has not only driven immunization policy changes based on her epidemiological research, but is mentoring the new generation of public health researchers through her own teaching and her research lab. An infectious disease epidemiologist, Nicole was selected to receive the Rising Star Award for advancing vaccine and vaccination research for a number of globally challenging viral and bacterial diseases, including COVID-19, meningococcal, and HPV. Nicole is the first person in her family to go to college and graduate, and boy, has she gone beyond. So I would just like to congratulate you for that. I know your mom is here, and your in-laws, and your husband, so congratulations, and we're thrilled that your family was able to be here with you tonight. The recognition for her extensive and impactful research has also been on preventing infectious disease, and in 2020, Nicole and a colleague developed an interactive online COVID vaccine tracker, providing near real-time updates to millions of users worldwide on vaccine development during the pandemic. In a moment, you're going to hear a little bit more about Nicole from her mentor, Dr. Elizabeth or Betts Hellren, who served as her dissertation advisor at the University of Washington. And since then, Betts and Nicole have continued collaborating through their shared interest in evaluating vaccines. Now, a short film about Nicole.
She's just someone with no ego, to be perfectly honest. She works hard and quietly and effectively, but is not one to put herself in the spotlight. And so it's kind of exciting to see the spotlight shining on her anyway.
My research focuses on identifying new evidence and seeking new knowledge that can help us determine how best to promote vaccination, to increase the protection against infectious diseases. And that's a really powerful approach, because the more knowledge that we have, the more power that we have to help people and communities stay healthy and really live their best lives.
I think one of the most impressive things about Nicole is the breadth of work that she has done. She has looked at vaccines for a huge number of different conditions. It's not just this important in-depth study of immunity and epidemiology, but she is also really committed to transmitting her knowledge to public health policymakers, to individual stakeholders, to patients and the lay public.
My research really starts when vaccines first become authorized for use in the population. We learn so much from clinical trials about the efficacy and safety of vaccines, but as soon as we have a vaccine available, there's so much more work to do to ensure that those vaccines get to the communities that need them most, that people are confident in taking vaccines, and that the vaccines can really do the job that they're intended to do in keeping people healthy and preventing infectious diseases.
I think she really wants to make wherever she is a better place and leave it improved, and that is part of who she is. She knows, being a first generation college student, that not everybody has a path laid out for them that they're pushed on, but that you do need that helping hand just for people to realize their potential and to realize where they can go.
So as a mentor, I work really hard to inspire students in the same way that I was inspired by my mentors throughout my career. I really benefited from the mentorship that I received, and I was really motivated to continue to train the next generation of epidemiologists and vaccinologists so that they too could contribute to the field.
I don't know many other researchers whose students continue to join their lab meetings just for fun. But I think it's a sign of the commitment that Nicole has to engaging her researchers, to empowering her trainees to really develop their own projects and find their own rhythm, and still providing them the guidance that they need to become independent researchers, but with that sort of shaping and help of her experience and her many connections and her skills in communication. Nicole's just always generous with her time, generous with her ear. She's always there to listen. She will provide guidance but not advice. She's never pushy or aggressive, even though vaccines have become in some circles a contentious topic. But she's just a lovely human being.
We're seeing such great public concern and lack of confidence in vaccines, and we're sliding back from some of the progress that we've made in previous years and previous decades. And that's really worrisome for the field, because we want to make sure that we're advancing the science, we're advancing opportunities to provide healthy options for communities to prevent the next infectious disease threats.
Hello. It is a great pleasure to introduce Dr. Nicole Basta for the 2024 Sabin Rising Star Award. I have known Dr. Basta since she joined my group in 2007 when she began her PhD program at the University of Washington. Dr. Basta has tremendous potential to make important contributions to understanding the effects of vaccines in populations and their public health consequences. I will present 3 examples from Dr. Basta's early career as a researcher that illustrate her dedication, independence, and leadership abilities. For her dissertation, Dr. Basta sought an opportunity to conduct fieldwork abroad to gain international research experience. I introduced her to an opportunity to collaborate with the African Meningococcal Carriage Consortium, known as MENAFRICAR, led by Professor Brian Greenwood at the London School of Hygiene and Tropical Medicine. The meningitis carriage study was implemented before rollout of the widespread meningitis A vaccination in Africa. Dr. Basta chose to work with the Center for Vaccine Development, Mali, in Bamako. She attended the first MENAFRICAR consortium meeting in Bamako, Mali, on her own, totally alone, without knowing anyone. From the outset, she integrated herself well and played a leadership role in a challenging setting. She proposed and developed the idea for her dissertation project, secured funding from the consortium, and worked on-site in Bamako for 3 months to launch the longitudinal pilot study of asymptomatic meningococcal carriage within households. For a United States-based PhD student to navigate her way through a consortium involving 7 African countries and several major institutions in Great Britain was not easy, but she did a spectacular job. Following the carriage study, the meningitis A vaccine was introduced across Africa. 11 million people were vaccinated in Mali. Nicole decided she wanted to evaluate the immune response to the new vaccine in Mali. Nicole is fearless. I still remember when, as a student, she walked into my office and declared that she wanted to apply for the new NIH Director's Early Independence Award that allowed even students to apply as PI for a grant. I had never heard of it. Long story short, Dr. Basta applied for and was awarded the prestigious 5-year NIH Director's Early Independence Award the first year it was offered. The award was for her research, antibody persistence after conjugate meningococcal group A vaccination in Mali. Dr. Basta used the Early Independence Award to spend a few years in at Princeton University. Another example of Dr. Basta's resourcefulness was while at Princeton. In late 2013, a meningitis B outbreak occurred among the students. At that time, no licensed meningitis B vaccine was available in the U.S. A meningitis B vaccine was offered to the students on the basis of special consideration. There being no medical school or public health school at Princeton, Dr. Basta seized on the opportunity to perform a study of the immune response to the vaccine, to the meningitis B vaccination. As a quite junior person, she put together the entire infrastructure, including finding a freezer and training phlebotomists to perform a study of vaccinated and unvaccinated students, and obtained funding from Princeton for it. This resulted in a high-profile publication, not to mention the valuable stored blood samples. After going to the University of Minnesota, Dr. Basta received a NIAID R01 to compare the immune response of the two, in the meantime, licensed meningitis B vaccines in a different student population. The results of all these studies demonstrate the value of evaluating vaccines in real time to guide public health policy. Dr. Nicole Basta has boundless energy, enthusiasm, and creativity. These qualities ensure that she will continue as a productive, leading researcher in the field of evaluating vaccines and vaccination policy. It is a great honor to introduce her as the recipient of the 2024 Sabin Rising Star Award.
Okay. Congratulations, Nicole.
Well, good evening, everyone. Thank you so much for joining in this celebration. It's really such an honor to be here. I am so honored to be receiving this 2024 Rising Star Award in recognition of my efforts to improve our understanding of the impact of vaccines and to increase vaccine awareness, equity, and access. This award is especially meaningful to me because I've long admired the work of the Sabin Vaccine Institute's global efforts to improve and expand immunization around the world and the accomplishments of all past awardees. This reward reflects not only my work, but the many collective efforts of my colleagues, collaborators, students, and trainees, because it's together that we've joined forces to ensure that we have the clearest evidence possible to better prevent and control a wide range of vaccine-preventable diseases, and also to translate that knowledge to action. Upon receiving news of this award, my thoughts immediately turned to my appreciation for the people and the experiences that have brought me to where I am today. Much of my inspiration for pursuing a career as an epidemiologist specializing in vaccines stems from some of my early work as an infectious disease outbreak investigator at the Florida Department of Health. During this time, I was called upon to investigate cases and outbreaks of everything from salmonella to MRSA to syphilis to brucellosis. I spent a great deal of my time at the health department communicating the latest public health guidance in conversation with school officials, migrant farm workers, incarcerated individuals, rural community members, and many others. During one particularly heart-wrenching investigation, we visited the family of an infant who was in critical condition, hospitalized with Hib meningitis. The child's mother was clearly devastated and distraught by what had happened. As we sat answering her questions, we came to learn that she'd never heard of this disease, that she didn't know that there was a vaccine available, and that the child hadn't been vaccinated. I reflected on all of the barriers to accessing a life-saving and readily available vaccine that this family had faced, and the dire consequences that they had suffered as a result. I began considering more carefully how we could improve vaccination and prevent tragedies like this one and so many others happening far too often around the world. After 2 years in that role as an outbreak investigator and many, many more investigations, I came to appreciate the broader impact that I might have if I worked to generate evidence about how best to get vaccines to those who needed them most, and if I used this experience in public health practice to bridge the gap between evidence and driving policy, to prevent many of the types of tragedies that I'd been investigating. Soon after, I enrolled in a PhD program for epidemiology with the goal of pursuing a research career and reducing the risk of infectious disease threats for the benefit of individuals and communities everywhere. Since then, I've been motivated by this dual desire to generate new knowledge about vaccines and to ensure that that knowledge does not just rest on the shelf. Two very challenging and rewarding aims, as so many of you will know even better than I do. Fortunately, I've had many opportunities to do just that. Our research examining gaps in the uptake of HPV, MMR, COVID-19, and influenza vaccines has really provided a lot of insight into improving vaccinations among many at high risk in different communities around the world. Studies that I've led to better understand the breadth and duration of immunity generated by Men A and Men B vaccines, as well as influenza vaccines, have helped inform vaccination strategies designed to reduce the risk of outbreaks and prevent cases. As you heard a little while ago, during the early days of the COVID-19 pandemic, my team and I developed an interactive COVID-19 vaccine tracker to monitor the hundreds of vaccine candidates in the pipeline and to map their availability globally. I'm very proud of our team for reaching millions and millions of people with this resource, and to all of those who sent messages thanking us for sharing reliable, unbiased, and evidence-driven information during such a challenging time. None of this would have been possible without the incredible support of so many people in my life who deserve to be recognized. First and foremost, my parents have been a constant source of inspiration to me. Despite not having had the chance to pursue education beyond high school, they're two of the smartest people that I know. My father, John, quite literally kept the lights on while working endless hours as a lineman at the power company, restoring power after outages. He instilled in me a very strong work ethic and often reminded me to just forge my own path if ever obstacles came in my way. My mother, Elaine, who's here with us tonight, was a top student in her high school, completing all of the business and college prep courses offered to her. She encouraged my three sisters and I to value our education from a very early age and to pursue all of the opportunities that she and my father didn't have. In doing so, she instilled in me a belief that anything is possible and gave me the self-confidence to aim high. Thanks to my parents' sacrifices, I had the chance to apply for and I was awarded numerous scholarships, which enabled me to enroll as a first-generation college student at Princeton University and to pursue graduate degrees at the University of Cambridge as a Gates Cambridge Scholar and the University of Washington as an ARC Scholar. This gift of an education connected me to so many excellent mentors who so generously devoted time and insight and to share their expertise, including Professor Halloran, who you heard from earlier today, Sir Brian Greenwood, Noreen Goldman, Tina Wolfson, Erica Moody, Mike Osterholm, and so many others. As an associate professor now myself, I cherish the opportunities that I have to mentor the next generation of epidemiologists to make sure that they're even better equipped to deal with the challenges ahead. And to that end, I'm so thankful for all of the members of my team, all of the students and trainees, and the many contributions that they're making to impactful research as well. And last but certainly not least, my husband Fareed deserves the greatest thanks and my utmost appreciation for his endless patience, thoughtfulness, and support from when we first met in high school until now. I look forward to many more adventures together in the years to come. In closing, I am truly humbled by this award. I know that I'm so fortunate to be living my dream of pursuing a career as an infectious disease epidemiologist to improve health and well-being for all. Vaccines are quite unique in that they afford us a rare opportunity to give everyone, no matter their circumstances, a chance to pursue their dreams as well. Thank you so much for this recognition.
Thank you, Nicole, and again, congratulations to all of our recipients tonight. I think you'll agree that the recipients this evening, as well as all of our past recipients, they have one thing in common, and that's that they exemplify Sabin's mission, and that's to make vaccines more accessible, enable innovation, and expand immunization across the globe. With that, I'd like to close the program for tonight, and thank you all for coming to celebrate our heroes, but I'd also like to invite you back in to the other room for dessert, drinks, and coffee so we can continue the celebration. Thank you.